Hey, what's up, everybody? Dr. Taylor, Aspire Chiropractic. Today, I want to talk to you. I want to give you just really a good overview of everything that we could possibly have going on with the knee. First of all, there's two E's in it. So, quick anatomy. Basically, if we've got the femur here, we've got the kneecap, and then we've got the tibia, okay? So, let's do this. We'll do it from the front, and then we'll do it from the back, okay? Back. So, on the front side here, what do we got? We've got our quads, right? It's a group of 4 muscles, boom, 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 like that. They come here, they all anchor and cross the kneecap, and then they go down and they attach on the tibia. We've got another group of muscles here on the inside, called your adductors, your adductors, to add, put together. And then on the back side, what do we got? We've got our hamstring group, right? They come down, actually we don't have a kneecap on the back, so I'll erase that. They come down on either side, and then they're attaching into the back side of the tibia, or your lower leg connected into the fibula there. And then we got down here on the front of the knee again, we've got a couple of muscles in there, your tibialis, and then on the back, we've got only one on the back, oh, technically two. We got 2 on the back that cross the knee joint. We got this little guy here runs diagonally called the popliteus, and we've obviously got our big calf muscle, right? So, what are some issues that we can have going on with the knee? Well, let's take a closer look in here. If we're dealing with this, right? So, if we draw the femur, it comes down, it's got a couple of knuckles on it, and it goes like that, and then we've got what's called the tibial plateau. It's basically the top of this thing here. So, first thing that any of us are going to experience with any kind of knee pain, obviously it's going to be younger, it's going to be in athletics, we're going to have either shin splints or something called Osgood Schlotters, okay? So, what that is, we've got the quads, right? They come down here, they attach to the kneecap, and then there's that tendon that comes down and attaches right in there on the tibial right below the tibial plateau. And then what is some kind of issue that some young athlete's going to get? We're going to have that Osgood Schlotters. What is it? It's pain right below the kneecap, right about there to get the knee way up here. So what is it? This here is an attachment point for that tendon, and it starts to pull away. Easy fix for that. This is something you will grow out of. A little bit of, a little bit of rest, a little bit of ice, but you will grow out of it. But what we'll do is we'll just tie a band around the top of the knee, bottom of the knee, top of the shin, if you will. Create a new attachment point right in there. That's the first experience, lucky us, that we're going to face with any kind of knee problems in a young, growing athlete. You see these kind of things a lot during growth spurts, during adolescence, just because of the tension that's put on that tendon right there. Next thing that we're going to experience here, potentially, it shouldn't be applied to everybody, we're going to have some sort of meniscus injuries. And these are the things that I see quite a lot coming into the office. This is going to be that clicking or that grinding that we have coming in. Because if we look at the knee again, so now what we're going to do, we've got our femur, we've got our patella, our kneecap, and then we've got the top of our tibia. So we're looking from the front here. Now we're going to turn it 90 degrees. We're going to look at it from the side. Looks like that. There's our patella. There's our tibia. So now what I'm going to do, I'm going to take this thing, I'm going to bend it, and I'm going to turn it back so it's facing us. So we're going to zoom in right here on the knee. So what do we have here? The top of the tibia, like that. We'll put our fibula right there. And then now our knee is bent. So there are those knuckles I was talking about before, right? It looks like that. So basically imagine what we're doing is we're looking at somebody who's sitting down, but what I've did right there would be our kneecap. That's going to be invisible for right now. Our meniscus is this pad of tissue, cartilage that sits right there on top of the knee. So now if we're looking straight down at that, it looks like a couple of ears, right? And what it does is it gives a little place for those knuckles on the bottom of that femur to sit in. And then when we're looking right in through here, another thing we can see if we're looking at like an MRI or something like that, is we're going to see our cruciate ligaments. Our anterior cruciate ligament goes like that, and our posterior cruciate ligament goes like that. we're going to see our medial, or our lateral and our medial. So those meniscus injuries that we're talking about, if we're looking at this blue thing here, now we're going boop right down on top of it. It's going to happen with some sort of twisting in the knee, some sort of plant and move, and we're going to get these little bitty tears, these little, what are typically called bucket handle tears. Now, good news is these are pretty much self-limiting. These are something that you can play with, for lack of a better word, depending on the severity of the tear. The bad news is the location of the tear will dictate how long it takes to heal. So if we go back to this meniscus here, what I want to do, and I'll drop bigger. Remember, we're looking right at that part there. Now we're looking at it from above, like that. The blood supply for this tissue only covers about the outer third, right? So cartilage already heals super slow and super crappy, and that's with blood. So if we've got blood supply that's kind of, not reaching the innermost part, and we get these bucket handle tears in here, those are going to take a long time to fix for the body to do on its own. So from a chiropractic standpoint, what do we want to do? We want to assess the knee, make sure this hinge joint is moving as well as it possibly can, so it's not putting any undue stress on these little tears in here. And over time, they will take care of themselves, provided you rest and all that kind of stuff. Now again, we've only got blood supply here, so if we get a tear out here, cool. That's going to heal a lot quicker, but a lot quicker from a cartilage standpoint, not from a general tissue standpoint. We go back to this. If we get these things in here, worst case scenario, if we get these bucket handle tears, they can start to flap around, and that's when we get things like the knee locking up. That is beyond chiropractic. That's going to be more of a surgical issue, because we got to clean this thing up here, because this is a weight-bearing joint, right? Everything that you have up top sits on those knees. And the crappy part about a knee is it can only do one thing. It can only bend forward and back, right? So if we've got a knee issue, in the most traditional sense, that's actually in the knee, that's going to take a while to care for. But also, if we've got issues going on above or below in the hip or in the ankle or in the low back or something like that, that's throwing off the biomechanics, that's going to make this take even longer. So some things we can do, like I said, from a chiropractic standpoint, number one, in this office, we work with athletes all the time. We work with a whole bunch of rugby players, professionals, we work with MMA fighters. We get these extremity issues that come in routinely. So we want to do a thorough orthopedic test. Make sure that we assess every ligament in the knee, whether it be the ACL, the MCL, the PCL, or the, what's the other one? The LCL that we're missing. We want to do orthopedic test to attest basically the tensegrity of the knee. How's that thing moving? Is it moving like it should? Muscle tests above and below the knee, and certainly assess the joints above and below the knee, like the hip here. There's our knee again, and then the ankle and foot. Because again, these things here, remember, can move in 360 degrees. This can only go up and down. So if you've got issues here or here, that's going to exacerbate any kind of things that you might have happening going on in the knee. Now, the good news is, more often than not, people that come in here with knee pain don't have knee problems. The grand majority of people that come in here complaining of knee issues have hip, low back, and ankle issues. And again, it just goes back to the fact that the knee can't compensate very well because it's only got one range of motion. It can only go forward and back. So we want to make sure that when we are assessing the knee, we're also checking the low back, we're also checking the hip, and we're also checking the ankle. Because if that or that or that has issues in it, then we're going to have a knee issue. So if you go to somebody with a knee problem and they only look at your knee and they send you on your way, go to somebody else. You want to assess the whole system, the whole limb, the whole person, not just where the site of complaint is. Now, everyone knows chiropractors are great at neck pain, back pain, and headaches. That's right in our wheelhouse. We work with the spine. But we are as well trained as anybody in basically how every joint in your body works. Spoiler alert, the knee's a joint. So come in here, Aspire Chiropractic. We're ready to help you when you're ready to be your best, naturally, because we work with athletes, professional athletes.